monitoring and managing the work. Arrangements must be made by the client to ensure the contractor complies with safe working practices. These arrangements should include
ജോലിയുടെ നിരീക്ഷണം, നിയന്ത്രണം. സുരക്ഷിതമായ പ്രവർത്തന രീതികൾ കരാറുകാരൻ പാലിക്കുന്നുവെന്ന് ഉറപ്പാക്കാൻ ക്ലയന്റ് ക്രമീകരണങ്ങൾ ചെയ്യണം. ഈ ക്രമീകരണങ്ങളിൽ ഇവ ഉൾപ്പെടണം:
having a signing in and out procedure, ensuring that the contractor provides a named work supervisor, carrying out site induction training for all contractor workers, controlling high-risk activities with a permit-to-work system.
സൈനിങ് ഇൻ സൈനിങ് ഔട്ട് നടപടിക്രമം ഉണ്ടായിരിക്കുക. കരാറുകാരൻ ഒരു പേരുള്ള വർക്ക് സൂപ്പർവൈസറെ നൽകുന്നുവെന്ന് ഉറപ്പാക്കുക. എല്ലാ കരാർ തൊഴിലാളികൾക്കും സൈറ്റ് ഇൻഡക്ഷൻ പരിശീലനം നൽകുക. പെർമിറ്റ് ടു വർക്ക് സിസ്റ്റം ഉപയോഗിച്ച് ഉയർന്ന അപകടസാധ്യതയുള്ള പ്രവർത്തനങ്ങൾ നിയന്ത്രിക്കുക.
The client will need to monitor the contractor's work to ensure that they are working to agreed health and safety standards. This can be done by monitoring against the risk assessment and method statement that were developed during the planning stage. If the client identifies that the agreed safe working methods are not being followed, then it is in their best interest to stop the work so that the issue can be addressed. We will cover permit-to-work systems in more detail in Element 3.
കരാറുകാർ അംഗീകരിച്ച ആരോഗ്യ സുരക്ഷാ മാനദണ്ഡങ്ങൾക്കനുസൃതമായി പ്രവർത്തിക്കുന്നുവെന്ന് ഉറപ്പാക്കാൻ ക്ലയന്റ് അവരുടെ ജോലി നിരീക്ഷിക്കേണ്ടതുണ്ട്. ആസൂത്രണഘട്ടത്തിൽ വികസിപ്പിച്ച അപകടസാധ്യത വിലയിരുത്തലിനും രീതിശാസ്ത്ര പ്രസ്താവനയ്ക്കും റിസ്ക് അസസ്മെന്റ് ആൻഡ് മെത്തഡ് സ്റ്റേറ്റ്മെന്റെതിരെ നിരീക്ഷണം നടത്തുന്നത് ഇതിന് സഹായിക്കും. അംഗീകരിച്ച സുരക്ഷിത പ്രവർത്തന രീതികൾ പാലിക്കുന്നില്ലെന്ന് ക്ലയന്റ് തിരിച്ചറിഞ്ഞാൽ പ്രശ്നം പരിഹരിക്കുന്നതിനായി ജോലി നിർത്തുന്നത് അവരുടെ താൽപര്യത്തിൽപ്പെടുന്നു. പെർമിറ്റ് ടു വർക്ക് സിസ്റ്റങ്ങളെക്കുറിച്ച് എലമെന്റ് 3 കൂടുതൽ വിശദമായി നമ്മൾ ചർച്ച ചെയ്യും.
Definition: Permit to work. A formal documented safety procedure forming part of a safe system of work, which ensures that all necessary actions are taken before, during and after particularly high-risk work.
നിർവചനം: പെർമിറ്റ് ടു വർക്ക് പ്രത്യേകിച്ച് ഉയർന്ന അപകടസാധ്യതയുള്ള ജോലികൾക്ക് മുമ്പും ശേഷവും ആവശ്യമായ എല്ലാ നടപടികളും സ്വീകരിക്കുന്നുവെന്ന് ഉറപ്പാക്കുന്ന സുരക്ഷിതമായ ഒരു പ്രവർത്തന സംവിധാനത്തിന്റെ ഭാഗമായുള്ള ഔദ്യോഗികവും രേഖാമൂലമുള്ളതുമായ ഒരു സുരക്ഷാ നടപടിക്രമം.
Study questions. 7. Which categories of people does an employer owe a duty to? Based on general health and safety principles and often enshrined in law like the Health and Safety at Work etc. Act 1974 in the UK, an employer generally owes a duty of care to their own employees. This is the primary duty, ensuring a safe working environment, safe systems of work, adequate training and proper equipment. Other persons who may be affected by their work activities. This includes contractors, visitors, members of the public, and anyone else who might be on or near the workplace and could be exposed to risks arising from the employer's operations. 8. List the criteria that might be used to assess the suitability of a contractor to undertake work on behalf of a client. To assess the suitability of a contractor, a client might consider: health and safety policy. Does the contractor have a robust and effective health and safety policy? Competence and experience. Do they have a proven track record of similar work, and do their workers possess the necessary skills and qualifications? Training records. Are their employees adequately trained for the tasks they will perform? Risk assessments and method statements. Are they capable of producing comprehensive and suitable risk assessments and method statements for the work? Accident-incident history. Do they have a good safety record with low accident rates? Resources and equipment. Do they have the appropriate and well-maintained equipment and resources to carry out the work safely? Supervision. Do they have competent supervisors to oversee their work? Insurance. Do they have adequate liability insurance to cover potential incidents? References. Can they provide references from previous clients regarding their safety performance? Membership of professional bodies, accreditations. Are they accredited by relevant industry bodies, e.g., Chase, Safe Contractor? Emergency procedures. Do they have clear emergency procedures in place? 9. What are the responsibilities of the client and the contractor where a contractor is working in a client's workplace? Client's responsibilities. Selection and assessment. To assess the suitability and competence of the contractor before engaging them. Provision of information. To provide the contractor with all relevant information about the site, its hazards, existing control measures, and any specific site rules. Coordination. To coordinate activities between their own staff and the contractor to prevent conflicts and ensure overall site safety. Monitoring and supervision. To monitor the contractor's work to ensure compliance with agreed health and safety standards, as highlighted in the provided text, using risk assessments and method statements. Stopping work. To stop the work if agreed, safe working methods are not being followed or if unsafe practices are identified. Site induction. To provide site induction training for all contractor workers. Permit to work systems, to control high-risk activities through a permit to work system. Access control, to implement signing in and out procedures for contractors. Contractors' responsibilities. Compliance, to comply with all relevant health and safety legislation, the client's health and safety rules, and the agreed risk assessments and method statements. Competence, to ensure their workers are competent and adequately trained for the tasks they perform. Risk assessment and method statement, to develop and implement suitable risk assessments and method statements for their work. Supervision, to provide a named competent work supervisor for their activities. Safe systems of work, to establish and maintain safe systems of work. Reporting, to report any incidents, accidents, or near misses to the client. Provision of equipment, to provide and maintain safe equipment and tools. Cooperation, to cooperate with the client and other contractors on site to ensure overall safety. Emergency procedures, to be aware of and comply with the client's emergency procedures.